If you use HIV medications, is it okay to use alcohol or other medications? Everything in moderation should usually not be an issue, but what you want to make sure of, especially when you want to take alcohol, is that your liver function is good. Some people are less lucky than others, and when they take HIV medication, their liver is, so to say, already fully occupied in handling the medications, and it will usually show in the blood results, and then we will recommend not to take any alcohol. Same is true for people who have liver infection, hepatitis, whether that's hepatitis B or C, then it's actually an absolute no-no to take alcohol. When it comes to concomitant medication, concomitant means that you take medication next to your HIV medication. The problem is that while most medications are not a problem, some are a very big problem and potentially very dangerous. And the only way really to not get into that situation is to always call your HIV clinic when you take something else, and to let them know. Just give them the name of what you want to take or what you're taking, and it should be very simple for the doctor or the nurse to tell you if that's okay or not. And in the rare cases that it's not okay, it's often really not okay. I mean, it really could lead to like cardiac arrest or other very dangerous situations. I think a big problem we have in Thailand is that a lot of drugs are bought over the counter at a drugstore, and a lot of prescribed drugs are given to you by a doctor in little small bags. And what you really want more than anything is always to know what you're taking. So if you go to the doctor or if you go to the drugstore and you get medications, don't buy them until they write the name of the drug on the bag, because only that way you can show it to your clinic or call your clinic and say like, I'm going to take this, is it okay? And again, most times it's okay, but sometimes it really is not okay. And the only way you can prevent that is by knowing what you're taking and letting your HIV doctor know. That's the best recommendation I have. For example, there are some drugs for migraine headaches that really should not be taken with, for example, ephedrins, which is a very commonly used drug right now. There are some cold medications that really should not be taken with ritonavir, which is less common right now, but still for people who take, especially for people who take ritonavir, which is often given with other protease inhibitors to boost the level of the protease inhibitor, it interacts with many, many medications. Again, a lot of these interactions are not so severe, but some of them really are. Also, for example, birth control pills work less well in women who take ephedrins because the hormone level in the blood is not as high as when you take the birth control pill alone without ephedrins. That's not life-threatening, but it can lead to very dire consequences. So I think whatever you take, check with the clinic, and they can really tell you within a matter of minutes whether it's okay to take it or not. Same thing, the problem with herbal medication is that it's harder for the clinic. As a doctor, I don't have a database, or there's very little research as to what the interactions with herbal medications are. A lot of herbal medications you purchase also will not say exactly on the bottle or the package what's in them. So while a lot of them may not do any harm and may even benefit you, as a doctor we're always weary of them because we really don't know. There's also been instances in the past, especially of herbal drinks in developing countries that are sold that have steroids in them, which are very strong and potent and sometimes dangerous drugs. So if we cannot trace what's in it, as a doctor we don't like it.